Welcome to Riverside Talk. My name is Denise Mananis, Associate Vice President of External Affairs at St. John's Riverside Hospital. So today we are speaking to you from the Ashling Irish Community Center about a topic that I think we are all very curious about, our aging eyes and what we should know about them as we get older. Today our speaker is Dr. Nicholas Donas. He is a board-certified ophthalmologist and fellow of the American Academy of Ophthalmology. Dr. Donas earned his medical degree from the Mount Sinai School of Medicine in New York and has been in private practice for over 20 years. Rivertown Ophthalmology is currently located in Ardsley. He was in Dobbs Ferry, but now he's in Ardsley. He is also the Director of Ophthalmology Services at St. John's, and he does perform surgery at our Dobbs Ferry campus. So welcome to the show.
Thank you for having me.
Sure. So we want to get right into our discussion. There are three diseases of the eye that I want to touch base with today. They are glaucoma, cataracts, and macular degeneration. So let's start with cataracts, because
Sure.
I think that's the one that most people kind of have an idea about. What is it?
So cataracts, first maybe to understand what a cataract is, we have to understand a little bit about the anatomy of the eye. The eye has two main lenses. It has the cornea, which is the front part of the eye, and there is another lens further back behind the iris, and that's what we call the crystalline lens. And in young people, that lens is very, very clear, and as we age, that lens gets cloudy. You can get yellow and sort of just less transparent. And when it gets cloudy, we say it's a cataract. That's what a cataract is. It's essentially clouding of the lens.
Okay. So is there a way to prevent the clouding of the lens, or is this something that just naturally happens to everybody?
So it's a natural process. It's the main cause of cataract is aging. So
Okay.
just the way our skin develops wrinkles and our hair turns white, the lens in the eye gets a little cloudy and yellow as we grow older. But there are some things we can do to slow that down.
Right.
We can, wear sunglasses to protect our eyes from the sun.
Okay.
UV rays are probably a very
big
big
cause.
contributing factor for cataracts. Also, eating diet rich in antioxidants, so eating plenty of green leafy vegetables, and fruits and vegetables, colorful vegetables and fruits, and and not smoking, doing things that we can avoid. That can also slow down the progression of cataracts.
Is there any correlation between the use of all the screens that we're all addicted to?
That's a good question. There really isn't. There's not. There really, any sort of energy coming off these screens really can't compare to the UV damage that we experience from the sun. So
I feel a lot better about things right
Yeah.
now. Thank you. Okay. All right. So you get to a point in your life where the doctor says, okay, your cataract is now at a point where it's really affecting your eyesight. And glasses are not helping to make it clear, your sight clear. So when do you know that someone should have surgery, and are there differences in the surgeries that you offer and the lenses that you offer for those surgeries?
Sure. So cataracts eventually get to a point where they start to affect activities of daily living, like driving, reading, or in some cases, even recognizing faces from across the room. Watching TV, for instance, people have a lot of difficulty, especially they'll tell me, my patients will say they can't read the scroll on the bottom of the screen. That's a big complaint people have. And of course, driving at night, that's probably one of the most common complaints, especially when cataracts first start to develop. Yeah. It doesn't mean necessarily that you have to have your cataracts removed, but if it gets to a point where, either your doctor strongly recommends it being done, or that, you feel yourself that your vision should be better than it is, then it's time to have the cataract removed.
All right. So what's involved in the surgery for a cataract?
So the surgery it's probably the most commonly performed surgery in the United States. It's also one of the safest procedures that's performed. And it's about a 10 to 15 minute procedure where very small incisions are made on the front part of the eye, like I mentioned before, the cornea. And we gain access to where the cataract is, where the lens is. And the lens or the cataract is removed, and an artificial lens is placed in where the cataract used to be. It's painless in the sense that we do use topical anesthesia, and patients oftentimes, in most cases, do get some sedation. So they're nice and comfortable and they're relaxed, and they're not, one of the biggest concerns is that the patient will see what I'm doing. So they'll ask me, will I see what you're doing? And you can imagine, if, it wouldn't be very, comfortable to see instruments coming at your eye. That's not what happens.
Okay.
You don't see that. You can't focus on what the doctor's doing. Most patients will say that the experience is much less of an experience that they expected, and they don't really experience pain, and they're, for the most part, very comfortable with the sedation that they get. Yeah.
And it's an outpatient procedure?
It's an outpatient procedure.
All right. So the lenses now, I do understand there are different kinds of lenses.
There are different types of lenses. For many years, we just had what we call standard lenses that corrected mainly distance vision. But if patients had astigmatism, or if they wanted to be able to read without glasses, that we really didn't have options for that. And now with what we call premium lenses, patients can really achieve much clearer vision at all distances. And we can correct astigmatism, we can give patients the ability to see far and up close and not have to wear glasses. So there are more options available these days.
Wow.
Yeah.
All right. And to choose those, I mean, insurance covers?
Well, insurance will cover a standard lens.
Okay.
Insurances do not cover
The premium.
what the premium lens is.
All right, but there's a difference that you can make up for the...
Exactly.
Okay.
Yeah.
All right. So do you need glasses then after cataract surgery?
So most patients will not need glasses for distance, at least after cataract surgery, unless they have an astigmatism that needs to be corrected. But like I said, now with the premium lenses, many patients do have the opportunity to be able to see at all distances without having to rely on glasses.
Okay. You can't get cataracts again after surgery?
Once a cataract is removed, it's gone. You don't get a cataract. It doesn't come back. What you can develop is a little film behind the artificial lens that could occur months to years after the cataract surgery. And if that happens, that can be corrected with a rather simple laser procedure that's done in the office.
Okay. All right, that's good news.
Yeah.
All right, let's turn to the next, I hate to put it this way, but the next disease.
Yeah.
Glaucoma. I've heard that name and that word for a long time. I have no idea what it is. What is it?
So glaucoma damages the optic nerve. So the optic nerve is what transmits information from the eye to your brain. And the optic nerve is something we're able to visualize in the eye exam. And oftentimes, elevated pressure is what causes glaucoma. And
Like high blood pressure?
No, it's elevated pressure inside the eye. So if you can imagine the eye is a closed compartment. It's like a ball, if you can imagine like a basketball.
Right.
If you could overinflate the basketball, it feels firm, right? So we're able to measure the pressure in the eye. And when the pressure is elevated, it can cause damage to the different parts of the eye. And when it causes damage to the optic nerve, that's glaucoma. Yeah.
So how does it just randomly happen that you have higher pressure in the eye?
So, we don't exactly know for sure why people develop elevated pressure or glaucoma. And unfortunately, you don't always know that the pressure is high. It's something you don't feel, and that's why glaucoma is often referred to as a silent thief of sight, because you could walk around with glaucoma for a long time, have sharp vision, and eventually lose your field of vision and not be aware of it. So this is one reason why it's very important to have your eyes examined on a regular basis, because most people with glaucoma are diagnosed at a routine eye exam.
Is there a hereditary
Component?
to that?
Yes, absolutely.
okay.
Most eye diseases, including cataracts, especially if you get cataracts at an early age, there is a hereditary component to them, but glaucoma especially.
Okay.
There is, if you do have a family history of glaucoma, we do recommend that you get your eyes checked at a relatively young age.
So checking them and then finding that you might have glaucoma and getting that diagnosis, is there a way to stop it? Is there a way to treat it? Is there a way to reverse it?
Absolutely, yeah. Well, unfortunately, we can't reverse glaucoma because it's nerve damage,
bad.
and we can't reverse any damage that's already occurred. But we can really slow it down and even stop the progression in many cases with medical therapy, eye drops, as well as laser treatments,
Right.
and in some more advanced cases, surgery.
Okay. So how do you, I mean, what are you operating on if it's the nerve that has been damaged? What are you doing?
That's a
to
good
it?
question. We're basically, if the glaucoma is in a more advanced stage, what the surgery involves of what we call a filtering procedure to help relieve the fluid and the pressure inside the eye by
Okay.
creating an alternative pathway for it.
Is there a medical or a pharmaceutical treatment for the high pressure? I mean,
So-
because once you fix
Yeah.
whatever you're going to fix or arrest the development of it, I mean, how do you prevent it from continuing?
Well, it's an ongoing treatment. Glaucoma involves, in the vast majority of cases, glaucoma is treated with eye drops.
Okay.
We also know that certain laser treatments can really help lower the eye pressure,
Interesting.
but it's an ongoing treatment. I oftentimes just, for patients to kind of get a better idea, is I relate it to or compare it to hypertension, high blood pressure, where you take your medication and your blood pressure comes down, but you still have what we call hypertension, even though your
Right.
pressure is normal, because you're taking a medication for it. So it's an ongoing treatment. You take the same way you would take your blood pressure medication. You
take
take your
the-
eye drops to lower your pressure, and it's a treatment that has to go on
Continue.
indefinitely. Yeah.
Okay. Okay. I wanted to really get to this particular disease called macular degeneration. My
Yeah.
grandmother had it, and she lived to a very
Advanced age,
advanced
yeah.
age, and by the time she passed, she had almost no sight left, but this is already 40 years ago.
Yeah.
So I guess what I want to first talk about is what is it? And I understand there's two different types.
Yeah. So macular degeneration involves the macula. The macula is the central part of the retina that is responsible for sharp vision. So what happens with macular degeneration is that the cells of the macula lose their ability to clear themselves from metabolic waste.
Okay.
And it accumulates, and that forms what we call drusen. And
So that clouds the
that's the back of the eye. So we've moved from the cataract, which is the front of the eye, to the very back of the eye, which is the retina.
Okay.
And the macula is, again, something that is visualized during an eye exam. And in some cases, we're able to pick up macular degeneration before it starts to affect the patient's vision. In these patients, we see some changes in the macula, and when we see these changes, we inform the patients that there are some things that they could do to slow it down. And it starts as what we call the dry type, and it sometimes progresses to the wet type. Fortunately, these days, and what didn't exist 40 years ago with your grandmother, we have treatments for macular degeneration that can really make a big difference in how patients see and how the disease progresses. So patients today have a very different prognosis than many years ago.
Yeah. Is there a genetic component to it?
There is
Okay,
genetic,
that's
and
too bad.
your grandmother, my grandmother had macular degeneration, and she lost quite a bit of her vision from
Yeah.
it later on in life. these days, there, like I said, despite the, the one thing that when you do have a genetic predisposition is that you just get, you need to get checked.
All right.
And you get screened at, I guess, an earlier age than the average person.
So is there, what are the difference in treatments depending on if it's still in the dry phase versus somebody who has more advanced?
So in all cases in patients with macular degeneration, we do recommend protecting your eyes from the sun. Okay, we know that UV damage, as in cataracts, and can cause progression of the disease.
Okay.
So we do recommend sunglasses always, and anything that's good for your health, like quit smoking. If you're diabetic, make sure your diabetes is under control, your blood pressure is under control. All those things are very, very important. In addition to that, there are some vitamins that we know have been found to really slow the progression of macular degeneration, and they're over the counter. The formula is called an AREDS2 formula. It's based on a very large study that has found a certain combination of vitamins to help slow down the progression of the disease. In cases where it does advance and it does progress to the wet type, that's when you develop bleeding behind it. It's called wet because you develop hemorrhages in the back of the eye. And those hemorrhages eventually can cause a lot of scarring and cause patients to lose their vision. And there's treatments for those, for that type of macular degeneration as well. And it's been around now for quite a while. There are injections, and of course, it's
People go.
Yes, it's not something you take lightly, but they're very helpful, and they've really it's been a game changer for a lot of patients. We've seen patients maintain their vision much longer. Is
there any truth to light eyes being somewhat more susceptible to macular degeneration than dark eyes?
There is truth to that.
Okay.
Light eyes are more susceptible to the sun, to the UV rays, and just like light skin is more susceptible. And that also because there's a lack of pigmentation in the front of the eye that's visible, but there's also less pigmentation in the back of the eye that will make those patients more predisposed to UV damage.
Okay, so it can't be cured, but it can be arrested.
Correct.
Okay.
Or at least slow the progression of it. Yeah.
What is an Amsler grid?
An Amsler grid it's just a set of straight lines.
Okay.
That is usually printed on a piece of paper. You could probably even find one on your phone. And when it's used to pick up any changes in your macular degeneration. And what it does is, when you look at the grid and you test one eye at a time, if you notice that there's any wavy lines in that grid, that's an indication that it's possible that the macular degeneration may have progressed.
Okay. And so that's something that you use to help determine the progression of the disease?
That's something the patients can take home with them, and they could, just check themselves.
So this is my wishful question,
Yes.
and that is, are there ways to prevent any of these, cataracts, glaucoma, and macular degeneration? I heard the sunglasses.
Yes.
Diet.
We mentioned diet.
Right.
So we know that eating a diet rich in green leafy vegetables, antioxidants, anything full with antioxidants and are good for the eyes. Of course, any sort of disease like diabetes and hypertension that be managed properly, and exercise, just like So I tell people anything that's good for the rest of your body is good for your eyes.
Okay.
Yeah.
All right, so I'm going to actually now open this conversation up to our audience to see if we have any questions from our audience. Yes, ma'am.
I have a friend and she got it done with laser. Is there a big difference between, is it the regular way?
So that's a good question.
So the question is about laser for which? For cataracts?
So the laser is a relatively new and a more advanced procedure that we do for cataract surgery. It doesn't fully remove a cataract. The cataract still needs to be physically removed, but what the laser will do is it will make the incisions that we normally would make with a blade, we use the laser. So in order to get to the cataract, we have to make some incisions through the cornea. The laser will make those incisions for us, and it also opens up the capsule that holds the cataract. It opens it up in a very precise way, and it also is used to soften up the cataract. So when we're removing the cataract, it can come out very easily.
But the laser is much more expensive, right?
It's not covered by insurance or Medicare. It's, but it is something that patients will pay out of pocket for.
Okay, right, I have another one and I won't hold you.
That's okay.
Give everyone a chance. My left eye, it doesn't open up on its own. And at night when I sleep, it closes down, and in the morning I have to help it to open up.
Yeah.
What's that about?
Well, as we get older, the muscles around the eye do weaken. The eyelid muscles can not function the way they used to.
Yeah,
Sometimes if the eye is a little dry, it can get a little sticky.
but
So
I do use drops.
yeah,
Yeah.
yeah. And in most cases, it's just some muscle weakness. Yeah.
Okay.
Doctor,
Thank you.
Sure.
thank
Thank
you. How often should someone go to the eye doctor, to an ophthalmologist?
So we typically recommend that after the age of 40, at least once or every other year, once a year or every other year. But after 50, and especially after 60, every year.
Okay.
And if there's a family history of what we discussed, especially glaucoma or glaucoma, you get your eyes checked at an earlier age. And with macular degeneration, definitely every year after 60.
Okay,
Yeah.
all right. Questions? Yes, ma'am.
When the cataract is operated on and they take out the natural lens, why can't they clean that lens and put the same lens back instead of inserting a strange foreign piece?
So that lens it's not that small. It's something that if it can't be physically removed in one piece. Once you open up the eye and get to that lens, it's broken up into many pieces and it comes out. It's just the way the anatomy is, where in order to get to that lens and to remove it, it's broken up into many pieces. It's not something that can be cleaned. It's not dirty. It's just the lens is not just cloudy or on the outside. It's the whole lens from inside out that gets yellow and cloudy, and it just needs to be removed.
Yeah. Questions? Anybody? Yes, ma'am.
What's the reason for water running out of your eyes at all times?
So we have our eyes produce tears. We need tears for the eyes to lubricate themselves, right? Otherwise, dry eye is a big problem for many people. So it's normal for your eyes to produce tears. We produce different types of tears. We produce tears, what we call basal tears, that are tears that are produced slowly throughout the day to help keep our eyes lubricated. But sometimes if you don't have enough of those tears, your eyes dry out and you get what's called reflex tearing. Reflex tearing is when your eyes start to gush because they feel a little dry or because you feel like there's a little foreign body in the eye. And that's sometimes you'll notice the eye kind of just start tearing a lot. Another problem that can cause tearing is if the tear duct, where the tears are supposed to drain out of, if that gets blocked. And that's something that can happen as we get older. The tear duct can become narrow, it could become blocked, and the tears have nowhere to go but to just flow outside off of the lids.
Any other questions? Yes, sir. Yeah? Yeah.
Oh, yeah, how'd you know I had a question?
I just looked at you and I saw it.
Oh, okay, yeah, sorry. I would like to inquire about the cloudiness, and I think it pertained to that or something else which there was, you couldn't know for sure about something. Was it the cloudiness? Or it could be treated except you didn't know know how it happened maybe, or it happening.
So
You know,
you-
is it the cloudiness, was that it?
Is
That's
that the-
behind the eye, it starts behind the eye.
The clouding, are we talking about the cataracts? Cloudiness from cataracts or cloudiness? Because, you know, if you have, there's different things that can affect your vision that could make it feel like it's cloudy. And it can be cataract, it can be, you know, macular degeneration. Sometimes it could be something simple like dry eyes.
Right, maybe that's what it was.
Yeah.
So, right, okay.
Before we take any more questions, and we will take that, I just want to close the show for our online audience. And I would like to just take a minute to acknowledge our community partners. Of course, we are actually at the Ashling Irish Community Center, and we thank them for partnering with us and helping us produce these programs for our community. So thank you for joining us for today's live talk. Don't forget to like and follow us on our social media channels for more educational programs like this, and we hope to see you again next time. Thank you.